Hello, my name is Shaun and my topic today is internet addiction. My major claim is that problematic internet use is an addiction. The controversy and contention on this topic stems from internet addiction not being recognized by the APA, American Psychological Association, or the AMA, the American Medical Association, as a diagnosis or disease. The implication is that it does not exist, and therefore there is no recognized treatment. This is wrong. Internet addiction is a valid addiction and should be considered a serious illness and approached with the gravity that other recognized addictions, such as alcohol or drug addictions, are attended with. Now I'm going to explain to you why problematic internet usage is a legitimate addiction. First, it meets the requirement to be considered an addiction by the APA. Second, problematic internet usage has a negative effect on the psychosocial functioning of the user. This means that internet addiction is detrimental to the addict's everyday life and social functioning. Third, the problematic internet usage manifests physical symptoms for its users, similarly seen in other recognized addictions. My first point, it meets the requirements of the APA to be considered an addiction. For something to be considered an addiction by the APA, it must contain 3 of the 7 possible criteria within the DSM-4, their diagnostic manual. Problematic internet usage fulfills A, cravings, B, the continuance of behavior in spite of knowledge of negative consequences, and C, the loss of control. Cravings. They manifest themselves as compulsive behaviors. Problematic internet users often will make unsuccessful attempts to spend less time on the internet. LaRose, Lynn, and Eston found in 2003 that these attempts result in symptoms of depression, irritable mood, or restless behavior. Another study in 2006 by Hahn and Associates within the American Journal of Health Promotion noted that these symptoms are also readily displayed within recognized addicts of addictions such as nicotine and alcohol. B, the continuance of behavior in spite of knowledge of negative consequences. In 2003, Shapiro stated within the Medical Journal of Depression and Anxiety that individuals will not attribute negative occurrences to the overuse of internet, and instead they'll exhibit typical addictive behavior and make excuses or become self-defensive when confronted with a problem. C, the issue of loss of control. In 2004, Young published an article within the American Behavioral Scientist, which made the connection that the problematic user will spend additional unintended hours on the internet and often lose track of time or be unable to sign off the computer. Young suggests that an internet addict will also risk significant relationships, their job, other opportunities because of their problematic internet use. Examples of this are like lying about time, being late to work, or missing social events. This brings me to my second point. Problematic internet use has a negative effect on the psychosocial functioning of the users. Namely, it limits their social life. In an article found within the Journal of Cyber Psychology and Behavior, Davis, Fett, and Besser found in 2002 that individuals interact with others for relationships exclusively online rather than engaging in interpersonal contact with individuals in the physical world. This process occurs because over time the user restricts himself to the computer activities that cause them to participate less in time and activities with other people face-to-face. Also, research by Campbell, published within the Cyber Psychology and Behavior Journal in 2006, has shown a link between the time spent online and psychological factors such as depression and anxiety. This research is exemplified by a psychologist named Kemp, who in 2006 did a study of Korean adolescents and found that 40% of his population's usage were severe enough to be considered an addiction and possessed a higher degree of suicidal ideation than the rest of the population. My third and last point is that internet addiction manifests the same physical symptoms for its users that are similarly seen in other recognized addictions. In 2004, Young found that clinicians have reported a rise in the number of individuals that sought treatment for internet addiction. In 2006, an Amsterdam clinic, whose sole purpose was to treat video game and internet addiction, found that individuals presented physical symptoms when they were placed in front of a computer that was similar to the withdrawal symptoms of other recognized addictions, such as sweating and shaking, Young also found that extended internet use can cause sleep deprivation. According to Beard in the Journal of Employment Counseling from 2002, other physical consequences from problematic internet use includes backaches, headaches, neck pain, and carpal tunnel syndrome. A 2002 study by Campbell in Computers in Human Behavior Journal supports this, stating that he found problematic internet users develop backaches and eye strain from extended periods of use. In conclusion, problematic internet usage is an addiction because it, one, meets the necessary criteria by the APA to be considered an addiction. Two, it has negative effect on the psychosocial functioning of the user. And three, it also manifests physical symptoms for its users, as similarly seen in other recognized addictions. Thank you.
All right, at first I wasn't sure that you were going to have much of a controversy, but then you explained that it doesn't fit into the classifications, or it hasn't been classified that way by the psychological group, so I'm willing to grant that there is in fact some grounds for saying that a controversy exists. I thought you had a good labeling on the secondary claims. It's pretty easy to follow, although I thought maybe you overdid it a little bit on that first point where it seemed like you had 3 or 4 minor claims that you're getting into, and that got a little bit complicated. You've got a lot of quoted material in the speech, and you're usually citing that material pretty clearly, so I thought that that worked well. At one point early on you said that there were 7 out of 10 criteria that would make it fit into the category of addictive behavior, and I was waiting to make sure that we had all 7 of those 10, and I'm not sure we ever got that. On the summary, I thought you did a good job identifying what the other criteria are, how it is we ought to make this assessment. Presentation's a little bit problematic. I mean, there's basically no eye contact. It's very dry, just a lot of data dumping going on there, so you want to be careful about that. All right.